Imagine floating near the ceiling of a hospital room. You look down to see your own body lying completely still on the bed, while your family mourns just a few feet below. Patients pulled back from the brink often describe this specific perspective. In April 1901, Dr. Duncan McDougall attempted to quantify this experience inside a Massachusetts hospital by studying terminal tuberculosis patients. He placed the patients' beds on its quantitative industrial scale to measure how much weight left the body at the moment of expiration. When the first patient's heart stopped, the scale's needle moved. The body's weight suddenly dropped by exactly 21 grams. McDougall repeated the experiment and recorded the same 21-gram loss. These results sparked a century of debate, providing the first modern attempt to find physical evidence that consciousness persists after the body fails. To understand why that 21-gram drop is so controversial, we look at the clinical rules of death. It begins exactly when the heart stops pumping blood, immediately ending the critical supply of oxygen to the brain. Within 10 seconds of that failure, your vision fades to black. By 30 seconds, your brain stops sending signals to your muscles, and the body goes limp. Between the 4 and 6 minute mark, brain cells begin to die from oxygen starvation. At this stage, the damage is typically permanent. Biology suggests that death should be a rapid, silent shutdown. Yet the data from survivors describes something far more active, a vivid and structured transition that contradicts our clinical baseline. In 2022, doctors in Canada were treating an 87-year-old man when he unexpectedly passed away. Because he was connected to an EEG at the time, his brain activity was recorded through his final moments. The data revealed a surge in brainwaves associated with memory and dreaming 30 seconds after his heart had stopped. Like a candle flaring up before it goes out, his brain reached its peak activity just as it was shutting down. This pattern is reflected in a 2014 study of 260 resurrected patients. 46% recalled specific voices, 9% saw visions from outside our world, and 2% reported looking down at their own bodies from the ceiling. One of the most verified cases involves Pam Reynolds, who underwent a complex brain surgery in 1991. To perform the procedure, her body was cooled, her heart was stopped, and her eyes and ears were physically blocked. Reynolds had no measurable brain activity and no way to see or hear. Yet upon waking, she correctly identified the specific surgical tools used and repeated the conversations her nurses had while she was clinically dead. We see similar anomalies in terminal lucidity. This is when patients with advanced dementia, whose brains are physically deteriorated, suddenly regain their memories and recognize their families just hours before they die. Post-mortem brain spikes, verified out-of-body observations, and terminal lucidity create a significant gap in our understanding. They suggest that consciousness can sometimes function even when the biological hardware is broken. Science attempts to explain these events through 3 main hypotheses. The first is hypoxia, where oxygen deprivation causes the brain to create a tunnel vision effect. However, oxygen starvation typically causes panic, confusion, and distress. This is the opposite of the profound peace and mental clarity reported by nearly every survivor. The second hypothesis is rapid dreaming. This suggests the brain runs a high-speed simulation in its final moments, using those recorded electrical spikes. But a subjective hallucination cannot account for patients like Pam Reynolds, who accurately observed specific real-world tools and events while her senses were physically obstructed. The third hypothesis is chemical release. It suggests the brain dumps endorphins to ease the transition and create a feeling of euphoria. While chemicals might explain a lack of pain, they cannot restore the physical neural pathways destroyed by dementia. A chemical dump doesn't explain how a damaged brain suddenly regains decades of lost memories during terminal lucidity. While biology provides fragmented explanations for parts of the dying process, it has yet to produce a single theory that accounts for an awareness that seems to work independently of the brain. While the journey of the mind remains debated, the fate of the physical body is a matter of absolute biological certainty. Within 12 hours of the heart stopping, gravity takes over. Blood pools in the lowest parts of the body, creating deep purple stains. By 48 hours, digestive bacteria begin to break down the body from the inside out. This process continues over weeks and months as the tissue is reclaimed. Eventually, only bones and hair remain before returning to Earth as dust. Biology is efficient. Every element of the physical body is recycled by nature, leaving no mystery regarding the fate of the flesh. We are left to reconcile two different accounts, a physical process ending in bone and soil, and a subjective one that often ends in a flood of light and memory. We can map the movement of every gram of blood and every bacterial colony, but we lose all visibility the moment the heart stops. The primary question of death is this total lack of data regarding where our consciousness goes once the engine fails. Because we cannot observe what happens after those final 21 grams leave the body, the most practical response is to focus on the life we are certain of by treating others well and finding meaning in the time we have left.